Okay, good afternoon, everybody. I see it is 12 o'clock and we are letting everybody in to our room here today. Just going to give us a couple of minutes as we have additional people joining. So bear with us. We're really thrilled that you could be here. Very good. Okay. All right. Well, I just want to go ahead and get us kicked off. My name is Angela Kelly Wiesek. I am the Chief Deputy Commissioner for Virginia Works. We are the Commonwealth's brand new state agency for workforce development and advancement. I say brand new because we're about 18 months old, but we have been in a creation stage since 2003 when we were signed into law by Governor Glenn Youngkin. And we really appreciate all of our employers who are joining us today. We, as an agency, have two customers. We have job seekers, but we also have employers. We like to say that we connect people to careers and employers to skilled talent. That is the mission that we live every day, not just here in Richmond at our headquarters office, but all throughout the Commonwealth. So we're thrilled to bring you Child Care Champions, the employer-focused webinar today. This is the sixth employer-focused webinar that we have done, focusing on topics that are of interest and real importance to employers throughout the Commonwealth in strategizing and solving your challenges as a business. All of those webinars are available on our YouTube channel, and we will give you that address at the close of this webinar. But again, for today, we want to talk with you a little bit about some innovative solutions that we have here in the Commonwealth, and we want to share with you a little sneak peek from some of our partners. So we actually are bringing this series of employer-focused webinars to you as what we're calling the Virginia Talent Network. And it's a partnership between Virginia Works and the Virginia Economic Development Partnership and the Virginia Chamber Foundation. And I just want to take a moment to thank Debbie Melvin and Tim Stuller from the Virginia Economic Development Partnership and Cindy Miracle from the Virginia Chamber Foundation for being our partners in this effort in 2025. Today, though, we are also joined by some other special guests and presenters who are joining us. First up, we're going to have Jenna Conway, who is the Chief of Early Learning and Specialized Populations at the Virginia Department of Education. And then we are going to hear from some of our friends at Ballad Healthcare. We have joining us Todd Norris, Susan Patrick, and Christy Worley, who will be introduced later in our slide. So we're also going to do a little bit of a focus group at the end of our session here, and then we will close out with some question and answers. So all during this particular webinar today, please feel free to put your questions in the chat. If we don't get to them as we move through the webinar, we will make sure that they are read out and answered at the end. And of course, if we can't get you an answer, we will follow up with you to make sure you get the information that you need. So again, thank you all so much for being here. Certainly hope this is helpful for you. And let's move forward with our next slide, please. Take it away, Jenna.
Wonderful. Good afternoon, I should say, to everybody who's joining. Thank you, Angela, and for your leadership. Thank you for all of the partners, including the Chamber and VEDP. It is great to see the agencies working together to tackle what is such an important challenge for the Commonwealth. I'm Jenna Conway. I lead our Birth to 5 as well as our specialized populations efforts at the Department of Education, and glad to spend this time talking with you, framing how we're approaching early childhood and childcare in an innovative way, partnering with businesses in the philanthropic sector, our public-private partnerships to improve outcomes, and then share with you and seek your feedback on an innovation that we are building as we speak. If we can move to the next slide, please. One more, please. So taking a big step back before we jump into some of the really exciting things that Virginia is doing in this space is to kind of connect us on our true north. And if you've heard me speak before, you've heard me say these words or share this slide, but it truly takes all of us working together across our public, private childcare and early childhood system to prepare all kids for kindergarten. Our sector is unique is that we not only support, as Todd and the partners from Southwest Virginia will share today, the workforce of today, but we are preparing the workforce of tomorrow. And we do that by working very closely, government and the private sector, to make sure that families have an array of affordable, high quality options. We measure all of the programs that take public dollars so we can share that information with policymakers and families alike. And it means that we're not only supporting better outcomes for kids, infants, toddlers, and preschoolers before they enter kindergarten, but we're also enabling parents to go to work, pursue job training, go to school, and ultimately seek to secure greater self-sufficiency for themselves and for their children. Next slide, please. Why does this matter? We have two key objectives under that true north of making sure kids come to kindergarten ready. The first is kindergarten readiness is a major predictor of academic and life success. And this has been shown in data from the Federal Reserve across the country, but I always like to share Virginia data with Virginia stakeholders and Virginia employees. What this slide shows, and basically what charts out, is that it looks at when kids enter kindergarten, how ready are they? And then how predictive is that when those very same kids get to third grade, that they're going to be reading on level. So what these bars on this graph shows that the kids in that gray and that blue bar, those are the kids that are coming into kindergarten very ready when you look at just their literacy screener. So this is not even a comprehensive screener, but when you look at the kids who come in prepared on those early literacy skills, that across the state, no matter what their kindergarten, first or second grade experience, that upwards of 80% of those kids are going to be on level by third grade, right? So if we can get them in, we can almost get ready or more ready. We can almost guarantee that they're going to be on level by third grade. And this is Virginia kids. In sharp contrast, for those kids in that yellow bar who come into Virginia public kindergartens less prepared, it becomes a coin toss, even with the intensive efforts of our K-12 system across the state, that only about half of those kids are going to be on ready by third grade. And as all of you have heard before, third grade is a really important inflection point because you begin to pivot from learning to read to reading to learn, and access to not only your English language arts, but your math, your science, your social studies, all of that really hinges on your literacy and language abilities. So number one is that we want kids to come to kindergarten ready because it makes all of our other systems, particularly our K-12 system, that more successful if we can have kids come in ready. Next slide, please. And then the second important Virginia stat for you. So not only do we know that if we can help kids come to kindergarten ready, that they're going to be more successful in school and beyond, but it's a necessity because we have seen year over year in the Commonwealth more children under the age of 6 who have all available parents in the workforce. And so that means not only do we know that this can make a difference in terms of kids learning and academic outcomes, but more parents are working than ever before, and they need to have a place where they can make sure that their kids are not only healthy and safe, but their kids are learning, developing, and thriving. And those are really the two pillars that are behind our true north and why early childhood and childcare matter so much in the Commonwealth. Next slide, please. So with that, and with this true north of making sure that every kid can come to kindergarten ready because of what that means for them, their families, and their communities, we in Virginia have been working across the aisle in a bipartisan way for the greater part of a decade to build out what we think is one of the nation's leading public-private parent choice system. It means we're looking at all of the places that kids are experiencing early childhood learning across public and private settings. So that includes family childcare, where entrepreneurs are offering childcare in their homes. That includes licensed childcare centers from nonprofits and for-profits, very small and mom and pop, to very large chains. It includes public schools, it includes faith-based programs, and includes early Head Start and Head Start grantees. And it truly takes all of us. There's not a single provider type, whether that's a public school or private childcare center, that is serving all ages of children. And so we've got to kind of think of this as a system. It's also important to know that it's the system that we advertise to employers when we're trying to attract businesses and economic development to the Commonwealth, because we know, and our data shows us, that we have a lot of different parent preferences, and they look different in Todd and Christy and Susan's area of the state than they might look in Northern Virginia or Tidewater. But making sure that we're thinking about this public-private choice system as a system of different options has been essential to not only preparing kids for kindergarten, but making sure that we're supporting all of the working families across the Commonwealth. Next slide, please. So what also makes Virginia unique, in addition to building this nation-leading public-private parent choice system, is that Virginia is leading the country in how we think about measuring quality. So if you think about what I've shared before, oftentimes it used to be just that parents were like, I just need someplace healthy and safe for my child while I'm working, going to job training or school. But increasingly, parents are saying that's not enough. I don't want to pay more than my mortgage, just to make sure my kid is healthy and safe. I want my kid to thrive. I want my kid to be learning. I want my kid to come into kindergarten ready. What Virginia has done is passed a law in 2020 and then spent the last 5 years implementing it to make sure that we can provide information around classroom level quality to all of our families. It's called VQB5. It has a website with information of over 3,000 sites, and it reflects information from 12,000 classroom observations, 2.2 million minutes of insight into what Virginia's infants, toddlers, and preschoolers are experiencing, and puts all that data at parents' fingertips. We know with this year's release that 99% of our public-private choice programs are meeting state expectations. And what it means is that parents, no matter where you are in the state, can go online, look at options in your community, if that's a small family child care program, that's a school, or that's a child care program, and learn about health, safety, and quality for all of those programs. This website has been a huge success, and since its launch in October of last year, we've had over 150,000 views across the state. Again, a competitive advantage, and certainly important for employers to make sure that families are aware of this option as they're picking the right choice for their kids. Next slide, please. So before turning it over to our colleagues, I'll give you one or two more kind of compelling data points on not only sort of how innovative Virginia's system is, but why that matters for employers. So a lot of numbers and colors on this slide, but basically Virginia has been working in partnership with this governor and the General Assembly to increase the amount of publicly funded childcare available for those families that can't otherwise afford childcare. And we know childcare can be really expensive. In response to that and making these big investments, what we've seen is that when we grow in response to parental demand, we make more slots available for families across the state. We make childcare more affordable for families across the state, that it is correlated with our workforce participation. So during the pandemic, the number of slots available and the number of families participating dropped pretty precipitously. Virginia was unfortunately one of the leading states in the number of parents, mothers in particular, that opted out of the workforce. And so we came together and said, how do we bring folks back and make sure that parents can work and return to the workforce? We made more slots available, we adjusted the rates, and we said, wherever there is need, wherever there are working parents, that's where we will make sure that the slots go. And as you see in this graph, from just about the end of FY 21 and forward, you see year-over-year growth. And when we grew the number of childcare slots, you also see that workforce participation grew. And when we had to slow that growth and create a wait list, you see that workforce participation start to drop again. And so just shows you this direct connection between being able to afford childcare and workforce participation. And surveys would also suggest workforce productivity. And so this is real Virginia data showing you that making sure that employees have affordable, sustainable, stable childcare is really important to ensuring that employees are able to work and be productive at work. Next slide, please. This is the flip of that in terms of looking at unemployment and those very same stats around childcare slots. So what we saw is we had significant unemployment coming out of the pandemic. We made more families eligible. We made more slots available, and we made them available all across the state in response to where there was the greatest demand from working families who could not otherwise afford childcare. And you see that as we grew the number of affordable slots, that unemployment dropped. We needed to go create wait lists, and you see unemployment starts to tick back up. And so just really important as we talk with employers, and Todd will lead the way in a second when we're thinking about kind of the relationship between how do you get employees to work, how do you make sure they can stay at work and be productive. The Virginia data suggests that there's a very close relationship for those employees who are parents, that making sure that childcare is addressed is essential to making sure that you can attract talent and retain talent. Next slide, please. And then one last piece of data before turning it over, we also think, and this has been really important in recent years, all right, well, where is this most important? Where is this most salient? And if we look at where families who otherwise can't afford childcare, they're coming to the state for support with these childcare vouchers, there's some clear trends in terms of who is really reliant on affordable childcare. This is the health industry, and I'll talk more about that in a moment. This is education, including childcare, retail, accommodation, government, and transportation. And what you'll notice is these are all essential in-person jobs, right? This is not, these folks can't telework. You can't have a nurse who's teleworking or a teacher who's teleworking, McDonald's telework. These are all in-person jobs that if they cannot secure affordable, stable, high-quality childcare, they simply cannot come to work or keep their jobs. And so a really important, even in the day of AI and all of the technological changes, that the vast majority of families who are relying on support from the government in order to afford childcare are these in-person essential jobs across the Commonwealth. So with that, if we can move to the next slide, please. One of the things that we're most proud of in our public-private work is really tapping into our brilliant private sector partners, including employers and businesses across, as well as some of our 501c partners like EO, which leads our Ready Region efforts in Southwest Virginia. This is really important because often innovation comes from those folks that can adapt, be nimble, and really think differently. And I'm so pleased to turn it over to Todd, Susan, and Christy, who are leading the way for the state and arguably for the country, and how they're thinking differently about the role that employers can play in supporting childcare for their employees. And as an added benefit for their state, they're helping make public dollars go further so that ultimately we can serve more kids, ensure that more working families can participate in the workforce, and see all those benefits for the Commonwealth. So with that, I'll turn it over to Todd, Susan, and Christy.
Thanks, Jenna. If I can have the next slide, please. So what we're doing here in Southwest Virginia is we're piloting the Tri-Share model for the state of Virginia. So a Tri-Share model is usually three contributing organizations to paying the cost of childcare. So childcare is very expensive. It's can be a huge burden on families. In Southwest Virginia, we see up to 24% of total income for a family, sometimes depending on how many children they have. So if you can kind of think about that on the scale of what a family might have to pay. So a tri-share model is a way of sort of spreading that cost across different participating entities. So for us here in Southwest Virginia, we're using a 3-part model that includes employers, employees, and some money from state general funds. So we call that strategy Ready Together. It's our tri-share initiative here in Southwest Virginia. And we've been doing this now for 2 years. It's part of Virginia's mixed delivery program, and it provides full day, year-round childcare services for working families. It has an emphasis on families that need to have year-round services, and there is a work requirement as well as an attendance requirement. So this is really designed to help stabilize and retain employees, make sure that they have strong childcare options available to them and that it's reliable. They know they're going to have consistent care available to them. It also supports those children in getting the kindergarten readiness skills that Jenna spoke about earlier. It's really helping to stretch the state dollars, as Jenna mentioned as well. It's this public-private cost share that is able to engage multiple partners and stretch those state dollars while still supporting families to work. It also stabilizes childcare centers. So childcare is a very unstable market. It's difficult to keep a childcare center open. The margins for profit, if there are any, are razor thin. And so having a reliable payment from a consistent source is very beneficial to providers and helps keep them open. Again, providing that stable foundation of childcare as part of your infrastructure in the community. That means that more families have access to childcare, even if they're not part of the Ready Together initiative. It's still helping all families. So I'll let Todd talk a little bit about the benefits for employers because he's experienced that firsthand. So if we could have the next slide, and then Todd, I'll let you talk a little bit about our collaboration. We've been doing this now for 2 years as part of the Ready Together initiative. Ballad Health was our initial employer. We've added on an additional employer this year in Washington County Public Schools. And I'll let Todd talk about how they've experienced this as part of the Ready Together initiative. Todd?
Thanks, Steve. Yeah, thank you, Susan. I appreciate it. Let me also take the opportunity just to, as Jenna and others did, thank all those in the Commonwealth that are working on this issue. Working with a healthcare system across multiple states, we see Virginia taking the lead in this area and see the impact, positive impact that it's having economically across the state, and really believe that the leaders in Virginia get this issue more than most. And so we appreciate that investment of time, energy, resources, and funding at the state level, including in this Ready Together pilot, which we do believe has potential to grow and have greater impact across the Commonwealth and also be a model for other states. Susan mentioned a couple of other states that have been doing this, and frankly, it's been done with mixed results and has evolved over time in different states in the way that they approach it. But that tri-share really has been thematic. Stepping back just a little bit, because I want to speak to this as a healthcare system, but also as an employer. As a health system, we 100% believe in all of the merits of providing high quality, accessible early care and education that Jenna articulated, specifically in community health and seeing the correlation between educational success, economic success, and long-term health for communities. educational success and economic success are the key differentiators for health in communities. And so, looking at that longitudinal pathway to health success, we've made investments there as a health system, and other health systems are as well. But it really takes this broad-based community and public-private sector approach to derive those results. Looking at this from an employer perspective, so Ballad and every other health system in the country faced, as many other employers did, faced tremendous challenges during the pandemic. We were facing challenges related to workforce shortages prior to the pandemic. In fact, for about a decade, our country has been on the verge of a pretty dramatic nursing workforce shortage. That was exacerbated by the pandemic and escalated by the pandemic. And we were looking at some of the largest turnover rates we had ever experienced, to the degree that we had, as other health systems, had to close services during that time because of staffing issues, and did not immediately recover from that after the pandemic. So we have made very substantial investments in our nursing workforce, including investments in childcare, specifically in making investments in regional capacity. Many people believe that childcare can be fixed with free market solutions. That is true in some markets. It's definitely not true in Southwest Virginia and many other rural markets across the country. And so we made an investment in that capacity, made an investment in what we felt like was an investment in that delivered an ROI in productivity, decreased absenteeism, and decreased turnover rates. Consequently, we've seen our turnover rates go from the highest in our history to the lowest in our history as a healthcare system. We definitely see that correlation between childcare availability and workforce participation, not only within our system, but at a community level. And when you look at something like nursing, it can cost as much to replace a nurse as it does to pay a nurse over the course of the year. So that ROI is definitely clear for us, and would be for many other employers. The Ready Together model works especially well because it has the employer, the family, and the state all with skin in the game, all making contributions that increase the affordability of childcare for team members, and specifically low-income team members and those in the ALICE status, those that are asset limited, income constrained, and employed. The lower income part of our workforce, which is, frontline, extremely important to the work that we do. And so having this program structured the way that it has, having the ability to have 61 of our team members involved in it, with 61 regional team members and 58 Ballad employees, has proved to have a substantial ROI and benefit for our organization. We look forward to continuing to test this out, look forward to speaking with other employers that are interested in participating and being an ongoing part of this important resource for the Commonwealth. Thank you.
Thank you so much, Todd. And we actually had one of Todd's nurses be one of our participants this year in one of our TriShare models. And so she was a mother that chose to stay home with her 2 young children, but found that it was, time to get back into the workforce. And so what Ready Together was able to do was get that mother back into the healthcare workforce, but also helped, cover the cost of care. And as you can see here, these co-pays help show the true cost of care, and so that those child care centers are receiving the pay that they should to stay open and have a high quality center. And you can see where the employers are paying $5,000, and then you can see as it goes down, and depending on income, would also depend on the family's copay as well. But what I wanted to focus on my part was our second employer that we brought on this year. So our team was tasked to bring on a second employer. And as we were looking for those opportunities, we came across Washington County Public Schools, who was already having a HSA for their staff for childcare. But it wasn't that true cost of care of the employer adding in $5,000. And so what we were able to do as a nonprofit was leverage some of our existing relationships with other foundations to meet that true cost of care. And so as you can see here, between Washington County Public Schools as the employer and that philanthropic partner, we were able to do the combined total of the $5,000 to really make that work for our second employer coming on with us. Next slide, please. Susan?
Yeah, I think that the key to our success in launching Ready Together was that we also were launching brand new childcare centers at the same time. So that is critically important to understand that you need to have a certain amount of supply that is accessible to folks. So we were able to kind of combine this initiative with the opening of several large centers across the region, and to make sure that we had a place to put all of these children whose families were part of Ballad's workforce. And so the other, sort of thing that I want to say is that we are seeking new employers in Southwest to participate in FY27. So that would begin in July of 2026. And we are continuing to outreach to any employers. So if you have any interest in Ready Together, want to learn more, want to talk about what it would take for your organization to be part of this, you're welcome to reach out to me anytime. And I'm going to drop my info into the chat.
Excellent. Thank you, Susan. Thank you, Christy, and thank you, Todd. As you hear in their presentation, it takes different partners coming together. I want to applaud this region of the state for identifying there was a need and continuing to be really flexible as they think through whether it's a partner with a school division or a big health system to in-person essential jobs, but looking at how we can, sort of think differently about all of the different options for childcare and how we are continuing to grow the system. And what we've seen is that supply, and even though we know that there are still challenges and childcare deserts across the Commonwealth, by taking such a proactive approach as Southwest Virginia is they actually are moving the needle on supply, and then really looking at how do we have enough resources to support that that need for childcare. I see in some of the comments in the chat kind of acknowledging that there are some challenges right now. There are currently wait lists, so we have more working families that are seeking childcare subsidy than there are available slots right now. We have shared this data with the commission as well as with the media. And I will note that the Governor Youngkin will be announcing his budget next Wednesday, December 17th, and that will give all of us a sense of where we are starting as we go into the 2026 General Assembly. And we're looking at kind of how many slots will be funded for childcare subsidy and for mixed delivery that will enable additional growth and additional innovation. Just one more kind of point to make here is that the work that Todd and Christy and Susan are doing are helping us stretch those public dollars that much further, that employers, by getting employers to contribute, and there's kind of a double bottom line here, as Todd describes, that it helps your employees, right? They're going to bring them back into the workforce. It is less expensive than kind of losing somebody and having to do all that training all over again. They have the kind of experience and the and the relationships and all those things to be successful. And it helps the state dollars go further. And what we've just seen is just extraordinary demand for families for childcare, largely because we see more families working than ever before, lower unemployment than ever before. And so we're just very appreciative to Ballad, to EO, and also our partners at the Virginia Early Childhood Foundation. So wait for next week, and that'll give you a sense going into the General Assembly of where we are. 2/3 of the public dollars supporting childcare, mixed delivery, state pre-K, known as VPI, are state dollars. So while other states mostly rely on federal dollars for childcare, Virginia is, and Todd noted this earlier, is truly leading the way in not only supporting quality and supporting some of this important public-private partnerships, but also putting their money where their mouth is in terms of deep and substantive investments in early childhood. Governor Youngkin's building blocks this year alone put $462 million towards early childhood, which is a historic high for the Commonwealth. So as you're thinking about one option around how employers can get more involved is through the TRISHARE model. But we realized that was not enough, and some employers might not be able to afford $5,000 per employee or even kind of a part of that. And so what Virginia is currently been building is a new innovation, a digital wallet, to make it easier for all types of employers to make any type of contribution towards employee childcare. And if we can move to the next slide, please. And as we've been working closely with Todd and folks like Susan and their leader at EO with the commission, the Early Childhood Commission, over the last few years to say, okay, how do we sort of take all of the different public and private resources to address what is this growing and really important need for affordable childcare in Virginia? And we realized that the chamber, our employers, and our businesses needed to be a part of that. And we realized that what they could be really useful is a tool that would enable them to contribute towards the cost. Some of the bigger ones do have the savings accounts and can support that, but there's not an ability for all sizes sort of easily to be able to contribute towards the cost of childcare. Similarly, what about sort of local government and/or community foundations, right? Like there's not a kind of existing vehicle that makes it easy to contribute towards the cost of childcare. So Virginia pursued a federal grant, a competitive federal grant. So noting that we have thousands of children on the wait list, we didn't want to take dollars away from slots, but pursued an outside competitive federal grant to test and build out an early childhood digital wallet. And this is something that no matter where you are in the state, it would be a technology platform that would enable parents to set up accounts for their children, employers to make donations in the name of children, and then parents could dedicate those donations towards childcare providers, and childcare providers through their portal to use those dollars, pull down those dollars to help use for care. So kind of the technology that enables additional dollars to flow towards childcare. This is, we think, one of the first of these type of pilots in the nation, and again would be this kind of sort of similar to the TRISHARE. It's sort of, there's 3 different portals or interfaces. One is for families, where they could receive funds from their employers or from philanthropy, for local government. It could be individual philanthropy, it could be a family member, or it could be a community foundation or something bigger, and then could dedicate those dollars directly to childcare providers. Can't just use them for anything, right? They would have to go towards childcare or family childcare or kind of whatever the preschool option was. It would allow for providers to have a portal to kind of agree to take those dollars and then use them for services and affirm the delivery of services, and whether it's employers, other third-party entities, individuals, or larger entities, to make those donations in the name of kids. So you're not just giving the money broadly, but you are setting up a specific wallet for a specific child. And that's really important so that you know that it's safe, secure, and will go towards this greater goal of making childcare more affordable for families. So that's the technology. If we can move to the next slide, please. So this gives you a sense of what it starts to look like. So this is the big reveal. If you're about midway through the webinar here, but we did a competitive process to find a vendor to build out this technology. And as I'll share the timeline in a second, with the goal of launching statewide next spring, but kind of wanted to share today as you're sort of thinking about what this technology or this platform could do for you or for your community, kind of gives you a sense of what the platform would look like for donors, right? So they could donate a certain amount. It could be a one-time donation. It could be a recurring donation, right? And you could see exactly where it went. So it went towards the Davis household and the Johnson household, right? And you could see the specific, the kid accounts underneath that. So really kind of enabling a donor to see, or an employer to see exactly where those dollars are going, and to trust in that they would be taken care of and that would go towards the cost of childcare. Next slide, please. And then you see what it would look like for families. And so we've got Jessica P., who is the mom of three, very busy. She's got a 3-year-old and a 4-year-old and a 5-year-old, and she's not loving the snow day, I can tell you that much, but gives you kind of the sense, okay, here is the account, right? It makes it easy to say, okay, I want this. I've got maybe that, Emily is in kindergarten now, is in an after school, right? And she goes to a different program. I have to dedicate those dollars to go there. And Sarah and John are at a family childcare program, right? And this is sort of, I receive the dollars from my employer, make sure the dollars go there, right? So even though there might be different programs and different options based on the age and the needs of the kids, that it's easy for Jessica in one spot to dedicate those dollars, track those dollars, and make sure that that's helping kind of, rather than a kind of informal network where I'm trying to scramble to kind of pay this provider and pay that provider. One place, seamless tracking for families. Next slide, please. So those give you a bit of a sense of how this would work, both for the donors, whether that's an employer, philanthropy, how it makes it easier for families. The back end for providers basically would sort of say, here are the dollars for this child, right? Making it easier for them to kind of keep their records, and to sort of adjust the tuition, right? Because it would be a lower amount after the digital wallet, and for all three parties to kind of easily track the investments. This gives you time and gives you a sense of where we are at on this. So we are planning to launch this in the spring, make it available for providers. We will have a full front-end design by the end of this month, and then we'll be out in the field testing this with employers and families, sort of getting them a chance to see how it works, show sort of its safety and security features, do some training, and then a goal again of a launch end of April, early May, for any entities that are interested in potentially using this, and kind of thinking about that. We also wanted to make sure that it was available as we go into this year's General Assembly, if there is an interest from lawmakers in potentially using this to support employers who might be interested in helping employees cover the cost of care. Next slide, please. Okay. I will turn it back to Nora, who will take us to Menti, but now is the time that we would love, with this kind of new idea in your head and all that you've heard over the last 40 minutes, to kind of get your feedback on how we can make this technology work better for you and for your constituents.
Thank you so much, Jenna. Hi there. My name is Nora Ferrante. I'm with Virginia Works, and we're going to go ahead and use a really neat survey tool called Mentimeter. And we ask, if you have your phone available or another tab in your browser available, we ask that you please go to menti.com. And you're going to go ahead and enter code 84018839. If somebody could help me drop that into the chat, that'd be great. But we're going to ask, I'll go ahead and give you guys a moment to go ahead and input that, please. And then what you're going to see is the screen change. as we transition over to using that tool. So again, that's menti.com, and then using that code that is in the chat that you'll see. And one moment, please, as we shift over.
Nora, while we're shifting over, I'll answer Samantha's question. Would this be able to be used for families of elementary, middle school students for after school and summer care costs? Absolutely. Part of this would be figuring out kind of how to make sure that you could use this for all of your childcare needs.
Okay, can everybody see some of the responses coming in?
I love all of the optimism here, Nora, in terms of the not yet, but wish we were. And also appreciate folks who are doing something. I think this somewhat, we know that's a very, folks are trying to kind of make inroads in this area. And I know it's become, even as Todd was describing, this is even dates back to pre-pandemic in terms of realizing for particular industries, this has been an issue for a while. And then huge thanks to those who are significantly helping employees cover the costs of care and other challenges related to childcare. Let's look at the different ways in which you might be supporting your employees with childcare costs. So are you offering on-site? Are you helping families find services? I know some folks have the spending accounts, any direct contributions to childcare. Some folks are also offering backup care benefits. So particularly for, I think about in healthcare, 24/7 services, and kids get sick or there are challenges. And so looking at kind of resources there. Oh, look, all the different options here.
So for other, or if there's not a choice here that syncs up, feel free to put that in the chat. Would also be helpful.
This is great. Excellent. So more than half of you are providing flexible spending accounts, which is a key resource. We also know that again helps chip away at the cost of care due to the federal limits that you're not covering the full cost, right? But that is really important benefit and has real tax benefits for your employees. Helping families find services. I know that's particularly important for employers where you might need some non-traditional coverage, and being that kind of support. I want to do a shout out to our Ready region. So we have a Ready region in every corner of the state. If you're like, I would like to help my employees better connect with options in my community to understand the quality, our Ready regions are charged with working with all sorts of public and private partners to make it easier for families to enroll. And so that's a key resource that Virginia has that most states do not. We also see that folks are doing some on-site childcare and then some direct contributions. So all of the different options across the state, with obviously the flexible spending accounts leading the way. Let's move to the next slide. Which of the following is a barrier to you in supporting your employees with childcare costs? This is helpful to know as we're thinking about how to partner government and the private sector to better and support employers across the state. And we realize that this might look different in other communities. That's why we have the Ready Regions, because wanting to make some of these sort of decision and insight and making sense of the data happening closer to kids and families, because what is really important in Southwest Virginia might be different from what is important for Southside or Tidewater. So budgetary constraints, not surprising, in terms of just the high cost of childcare. Concerns around fairness in terms of, well, this is more beneficial to one group rather than another. Although I'm sure, as sort of Todd and others can attest, it's if somebody calls out, it has a disproportionate effect on everybody else who's also working that shift. Uncertainty on where to start. And then the lack of tools, which again, something like the digital wallet could be really helpful. One of the reasons that we're pushing so assertively on the digital wallet is I think that sometimes, and I know we've talked about this with our partners at EO and at Ballot, is sometimes the barrier to entry can feel really high. You either have to be a certain size in order to be able to afford this, or you feel like you need to make a multi-$1,000 contribution. Our hope with the wallet is that it creates a very low barrier to entry. Even just a little bit of money towards childcare can make a big difference for employees, and that sort of reduces some of that friction around the cost to be able to do this relative to some of the other ways in which, obviously, building on-site childcare is pretty cost prohibitive for most businesses and almost all small businesses. But the digital wallet is something that a small business could easily use. Other manpower employer resources, that's fair. Thanks, Jackie. We ask HR to do more and more and more and more and more. So that is true. Next slide, please. Okay, how likely are you to use the digital wallet platform as an employer? For those of you who are employers on the call today. Brian raises an important point about the different times. And so as we've really been including that slide with the different types of employers, kind of recognizing, again, where there are the greatest challenges or pain points around this need for childcare. And he makes a really important point about some of the non-traditional hours. And so thinking about, many childcare centers do open at 6 or 7, but if you need to be at site on the ship, right, you got to be dropped off at 5. And what's really hard for a childcare program, that means you're just open for many, many hours, right? Most childcare programs already need 2 shifts in order to support families to be working for 8 to 9 hours. And so it's even more of a challenge in some of these non-traditional hours. And so looking at how you can work with the Ready Region and explore opportunities here. So we have very likely, and I'm not sure. So this is great. This is great. I think part of why we wanted to have this conversation and sort of look at who we could test the digital wallet with in the spring is spreading the word. I know somebody noted in the chat earlier the importance of doing that. And again, creating a very low barrier to entry for folks who will be interested and just want to test and try and see if this could have a positive impact on their employees and their ultimate HR strategies, attraction, retention, and productivity. And then Erica raises a good point about a resource. And so we can certainly create kind of a one-pager, particularly when we think about this testing and this resource and how to get this out to not only our big employers, but our small businesses as well. All right, what features or incentives would motivate you to use a digital wallet? So just kind of a couple, and similar to Angel's point earlier, if there's an other and you want to pop that in the chat, go ahead and do that. While you're thinking of this question, Suzanne asked a question about beyond TriShare. There are policies or programs in other states that you're looking at that could move forward in terms of childcare availability and affordability. So we continue to monitor what's happening in other states. I think, as Todd noted, Virginia is ahead of many states in terms of its a very large state investment. Virginia funds its childcare slots closer to the cost of quality than most other states, which that helps really make sure that it's a valuable voucher for families and that enables providers to not only kind of enter the industry, but add more slots. One of the graphs we didn't show was that as we grew the number of slots and we made more families eligible and we made the vouchers more competitive, we saw that more private providers were willing to participate, including small family childcare, which often can be important. Often, to the point made earlier, sometimes small family childcare will let you drop a kid off at 5 a.m. Rather than a big center. And so we've seen a lot of growth in supply in response to what we're doing. The biggest challenge is it's just a very labor intensive. So we're trying to streamline regulations. We got to keep kids healthy and safe, but not have too much burdensome regulation. But it is very labor intensive, right? If you are dealing with infants, you cannot have even, a kindergarten classroom can be 20 kids. You can't put 20 babies with an educator, right? You can put 2, 3, or 4 babies with an educator. And so the biggest challenge around affordability is just the labor intensiveness and then the hours that we have to cover. And in turn, our childcare educators often make $17, $18 an hour, and they too face some real challenges around teacher turnover. So Suzanne, it's a great point, and it is the single thing that keeps most of us on this webinar up at night in terms of how do we continue to look at what's happening across the country, how do we look at our own data, and how do we continue to share this data with the important elected officials who make the decisions about how many resources go towards these sources. So a match, this is good, as most folks would say, a match would make a big difference in kind of getting an employer to contribute, also noting some technical assistance and then making it really easy to use. And that's a really important point. I think as part of that, maybe those funding plans, also thinking about models for kind of a set model and how to think about how much, right? Otherwise, it's great that there's a low barrier to entry, but do I give, $100, $200, how to think about that? So that's good feedback for us in terms of, as we roll this out, thinking about, are there kind of a couple of examples or exemplars that would make it even easier in terms of taking all of, the kind of the complicated thinking out of it for employers and for those HR and other strategic leaders who already have so much on their plates. Easy is key. Samantha, I hear you on the FSA. I still, every year I'm like, oh my gosh, do I make sure everything is documented, right? Because if you use it or lose it, and so all of those complexities. So thinking about how we reduce the burden for those who donate, for those who use, and obviously for providers is essential to making this platform successful. All right, next slide, please. Okay, now this is the fun one. No stakes. Okay, no stakes. Yeah, we're thinking of names. So we've got a couple of CarePay, Bright Fund, Early Wallet, Childcare Wallet, eLearn Play, or if you've got an awesome idea and want to pop it in the chat, we'll take that too. But we're trying to think about what is not too hard to say. We want to avoid an acronym. We have so many acronyms already in government, and we just love your feedback, and feel free to be creative. I will say we even, consulted AI on sort of what were ideas about names, but very, very curious. Or if you're like one of those people that comes up tomorrow, send us an email and let us know, but we're still looking for a name for our wallet. CarePay, leading the way. Oh, thanks, Brandon. Brandon shared something about Tennessee. We've actually worked really closely with that public-private partner in Tennessee. Their head is Blair, and she and I have had a lot of conversations about, how do we kind of, particularly in some of these areas, support different ways to engage employers. Excellent. All right, CarePay is the leader, for at least for this particular audience. Okay, with that, I know we're almost at time, but I want to make sure that, oh, last minute we get a tie. That's interesting. Interesting. I feel like that is, Nora, I wonder if that's like the internal parent where it's always like whenever there's like a family sporting event, you make sure that we end when there's a tie. So I feel like that's a fair and appropriate way to end this today. If there's any questions in the chat, I think we've answered them. But if there's anyone that will give another just couple of seconds if you want to pop any questions in the chat.
I think one of the, I was trying to review them, and I think one question or one theme, a couple of different takes on it was, could you speak to the any tax implications, whether these would be deductible or whether there would be tax implications for employers or employees receiving some sort of credit or assistance would be helpful.
Yeah, no, that's a great question, Angela. I think we have begun to look in that, and we've tried to, that's a great point raised by some of the folks asking about other states, is sort of to look into kind of how they've handled it. Generally, we understand that for actual tax advice, right, that our answer as government is go to, sort of speak to your accountant, but we are being very thoughtful about how we would make it really easy for you to have information about what you had sort of donated or received, right? In the case of either being a donor or in the case of a, whether that was a sort of, philanthropic or if you'd made a donation. So we will be thoughtful about making sure that it will be easy for you to document giving the money and sort of where the money went for those purposes. And we'll probably then put some disclaimers out there about kind of how to think about tax implications and who to talk to as it relates to your individual circumstances. As we wrap up, and I want to be respectful of time, huge thanks to our colleagues, but here is a little bit more information. There is another QR code. We are bringing you all the technology this afternoon, but if you would like to kind of give us more insights, there's a survey here. You can just hold up your phone and give us that information. If there are questions about the digital wallet, tomorrow morning you wake up and you have the name for us, please feel free to kind of email us, or if you're interested in potentially being a part of the user testing this winter, please let us know. If there's questions about Ready Together, you've got Susan's email address as well. I still see great questions coming in. We'll take these down. Thanks, Karen, for that question about thinking about kind of a portion of paycheck. And then I see something from Nicole around thinking about family day systems. We'll work with all different partners. So if there's something specific, please don't hesitate to email, and we will continue to work with Virginia Works, VDP, and Chambers as we build this wallet and test things like TriShare to engage employers across the Commonwealth. And I'll turn it back to you, Angela.
Well, thank you so much, Jenna. And thank you, everybody, for all the great questions. I do just want to note that if we did not get to your question, we will do our very best to take those down and answer them back out in a follow-up to all the registered participants. We will share a link to the full webinar, which will go up on our YouTube channel, which is at Virginia Works Official on youtube.com. And again, we will do our best to answer all of those questions as best we can if there's an answer. And then I just wanted to give everybody a quick sneak preview of what's coming in 2026. We are going to be embarking on an exciting initiative to increase employment and wage data, collecting additional information from employers and then getting that back out for your use. And so there's going to be more information coming soon on that. We are working on a new schedule of employer-focused webinars for 2026. In fact, we are hoping to do one targeted to daycare and early childhood care and education providers, and really get into some of those questions that you all had about, hands-on solutions for professionals in that industry that many of us do depend on and have depended on in the past to care for and love our children while we are working. So we also want to make sure that you visit us at virginiaworks.gov for the kind of full suite of employer support services that we're able to provide to you. Just click on the button that says I am an employer. And then again, if you've got suggestions on those topics, please email us at info@virginiaworks.gov. So again, thank you very much. Thank you to our partners. Thank you to Jenna and the entire Virginia Department of Education team. Thank you to our friends at Ballot Health for that fantastic outline of the great work that you are doing. And we will see you all in the new year. Happy holidays, everyone. If you've got snow on the ground like we do here in Richmond, stay safe and warm today. Take care. Bye-bye.